Measles cases are rising across the country, and health officials are struggling to make sure immunization rates are up. CTV's Heather Wright in Toronto on why some schools are resorting to suspensions. Heather.
Well, Sandy, thousands of high school students in Toronto facing suspension due to vaccination records that are not up to date. But experts say this is not just an immunization issue, but a clerical one as well.
Rolling suspensions have begun at Toronto high schools, with roughly 425 students suspended so far this week for not being up to date on their vaccinations or not filing the proper paperwork.
It's not a mandatory vaccination, but it is mandatory choice. They have to decide vaccination or exemption and submit those documents to public health.
Under Ontario law, students must be vaccinated against various diseases or provide a valid exemption. These types of notices are sent to students every year, with this year's cohort of grade 11 students larger in part because they were in grade 7 during the pandemic and may have missed some of the vaccines typically given in school.
This process, while labor-intensive, while extremely stressful for parents, families, schools, it actually works to get our vaccination rates up.
Experts say this process is especially challenging because Ontario still uses paper immunization records, not digital ones. And not everyone reports their vaccine status to health authorities.
We're sort of going blind here in many of these issues.
Dr. Kumanen Wilson has been pushing for a digital system for over a decade, something he says is even more urgent given the spread of measles in many parts of the country.
You need to have high quality data on who's vaccinated. You can't have a 5 or 10% error rate, or else you won't know if a region is not protected.
Another issue compounding vaccination rates is access. Many vaccines are given by primary care doctors, and millions of Canadians don't have one. Sandy.
Heather, thank you.